Hi, my name is Andrei Zinchuk, and today we're going to talk about the importance of sleep and what happens to our brain and our emotions when we don't get enough of it. And then in cases where you can't get enough sleep for a short period of time, I'm going to give you some strategies that you can use to help go through the day with as minimal disruption as possible. Every hour of sleep is like money in the bank. And so lack of sleep contributes to a lot of dysfunction. And because sleep is linked to almost every function of our body, from in the immune system to our neurocognitive system, it really has broad implications. And so we feel this most when it comes to our brain and how we interact with the world. A single night of sleep deprivation can impact our memory and our attention. And moreover, it can even create false memories. And so one of the easiest things to measure is the reaction time to a specific stimulus. And so we know that people tend to make A, longer decisions, and B, those decisions tend to be more incorrect. But it's not just thinking that's affected by lack of sleep, it's also our emotions. As we all know, when we're sleep deprived, we tend to be more irritable and tend to feel sleepy. And so those two symptoms over a long haul can lead to things like depression and anxiety. And on top of this, we, when we're sleep deprived, have a hard time reading other people's emotions. So we have a harder time recognizing whether someone is stressed or not, whether someone's excited or not. And so all those things tend to impact our ability to interact with the world in a healthy, meaningful way. Similar to our analogy of money in the bank, every day of sleep deprivation is like compounding interest on the loan that you took. And so the effects of sleep deprivation build up. So for example, if you take 20, 30-year-old individuals and deprive them of sleep for, let's say, 4 to 6 hours a night, and you do this for 14 days, what you'll notice is that with each single day of sleep deprivation, their reaction times get worse, their memory gets worse, their ability to do critical thinking gets worse. And after about 7 days of sleep deprivation for 4 hours, it's kind of equivalent to not having slept for 2 days in a row. It turns out that what we perceive as irritability, lack of concentration, and other symptoms tends to actually level out after a few days of sleep deprivation. We sort of adapt to it. But if you actually do objective testing on performance and attention and reaction speed, those decrements continue to decline over time. For situations with short period sleep deprivation, maybe 1 or 2 nights where you can't get optimal sleep, there are a few strategies that you can do. Number 1 is be kind to yourself. Don't get frustrated that you're not getting sleep. Number 2 is give yourself an opportunity to recover from sleep. Number 3 is take a cat nap. 20 to 30 minutes can really go a long way to help you feel more refreshed during the day. And other strategies that can help you are being exposed to light during the day, using caffeine at strategic times, especially before 2 or 3 p.m., and then also exercise and some yoga mindfulness practices that can help us maintain alertness during the day. So what caffeine does is it blocks the activity of something called adenosine. And adenosine is a body molecule that controls sleep propensity. So meaning, do we want to sleep or do we not? And the way I think about it is sort of like if you have an hourglass of sand, and the sand in that hourglass is adenosine. So when we wake up, the hourglass is flipped upside down, and this adenosine starts to trickle down into our body and our brain to create our need for sleep. And so by the end of the night, all of that sand is at the bottom of the hourglass and we feel like we have to go to sleep. And so what caffeine does, it actually blocks the activity of this adenosine molecule. And so it prevents us for a short period of time from feeling as sleepy as we would be otherwise. And so that's how it works. And if we use it strategically during the time that we feel most sleepy during the day, it can help us stay awake. Now, just like anything else in this world, there's nothing free. Right? Caffeine can have some side effects, and probably the most common one is using too much of it at the wrong time. And so if we drink caffeine after 3 or 4 p.m., it can actually delay our ability to fall asleep on the night of the recovery. And so for that reason, we don't recommend use of caffeine after 2 or 3 p.m. And if you are going to use it, use somewhere between 150 to 300 milligrams of caffeine. So that would be a regular coffee or maybe a coffee and a half in a 12-ounce cup. In addition, for some people, caffeine is going to be hard to handle because caffeine is a stimulant. It also stimulates heart rate and can promote anxiety, and so you really want to make sure you start with a lower dosage before moving on to higher doses. So the bottom line is that sleep is really important, and when we get less than 7 hours of sleep on average per night for an average human, we tend to have consequences for how we think and how we react to people around us. And so there are some strategies for dealing with that. And if you have chronic sleep deprivation, I would strongly encourage you to talk to your doctor or a sleep specialist to help you deal with that.